my contact information, and I'm available to entertain any questions that you might have.
Can I ask you a couple questions?
Yes.
So one question I had is on the scoring. So for my recollection is correct, scholars, yes, had to have the higher score, the 17 now, as you say. What's the scoring for the loan repairs?
Okay, good question. So as of about 2 years ago, the National Health Service Corps, in an effort to really increase our workforce, our field strength of providers, they were willing to place loan repairs at sites even that had a HPSA score of 0. They still had to go through the approval process to become an approved site, but even if they had a low score, loan repairs could work at that site. I'm hearing that on our radar screen in the near future, they will move back to a more competitive scoring system, ranking those sites, again, the higher the score, the higher the need. So stay tuned, but I do hear that that's coming just because of our numbers have increased. So,
Let's follow up. Are you turning away any? I mean, obviously for the scholarships, you have a finite number, and people get them or they don't get them. But are you turning away many loan repair applicants?
I wouldn't say turning away. It is an open-ended application cycle until the money runs out. So it is kind of first come, first serve in terms of application. We do encourage people to apply if they're considering it. You know, don't hesitate, don't wait. But again, until the money runs out, certainly when it comes down to an individual scoring, lots of things come into play. If they find that there's an adverse action on the National Practitioner Data Bank or any other, you know, their loans don't qualify, or for any other reasons, if they're not working at an approved site, you know, as they start to go through. So those kinds of things could be a reason why somebody would not receive loan repayment. But other than that, if they meet all of the criteria and they're qualified and they're licensed and they're working at a site, we usually tend to award them.
As long as there's money. Does the money usually get dried up by some part of every year, so you just have to wait till the next year? Or? We
did have that experience last year, which was good and bad. So we were excited that many people applied, and we were able to really increase our workforce and our field strength. But we did run out of money. But the Bureau was able to obtain additional funding to make awards for an additional 1,000 loan repairs that were eligible, did meet the criteria, and would have been funded with that original batch of money. So it can happen, but we also see that as a good thing. So our program is working. There's lots of people interested in participating. Again, as I think I mentioned to you before the video started, that we heard that we have an approved and appropriated funds through 2015. So we feel pretty secure that there's money available to support the program. Yes?
So when would, I mean, because right now we're second-year medical students going into our third year, and so when would, if we were interested in the loan repayment program, when would we start to work towards applying towards that?
So for loan repayment, you actually have to wait until you're in practice and working at a site. So that is your baseline. You first work at an approved site, and then you're in position to apply for loan repayment. Scholarships a little differently. So even once you have been accepted by the medical school, you're in a position to apply for scholarship.
And can we apply at any point during our medical school?
Yes.
You can, however, while you're in medical school and residency, work at sites and kind of see if it's the kind of the place you want to work. And you can find out their HPSA scores and kind of plan your future and get to know them so that it's smooth.
Yes, thank you.
You had a map up?
I did.
And it had some different colored dots in Hawaii. And I was wondering what those were.
I'm wondering too, Dr. Rippey. Let's see. Hold on, it's kind of frozen. Oh, wait, there we go.
Okay. It looked blue. Oh, I see.
Okay.
There's scholars in there.
I don't have my glasses on, so yes. So the white dots, is that a dot or a diamond? Okay, it's yellowish. greenish, yellowish, is the loan repayers. The blue is the scholars, and the white are volunteers.
What are volunteers?
Volunteers.
But they don't get repayment?
No. Yeah.
Would that be like ambassadors?
Honestly, I
Are there not any sites on Guam? Because there are no, like, there are no dots on your map, like.
There's no
We-
repayers.
Oh, I see. 'Cause
Yeah.
when we were on Guam this past summer working at a community health center, I know for a fact that one of the doctors there is part of the health service corps.
Yes, and this is outdated. This is May 2010, and I don't know when we'll have access to a newer map. So, but you are correct, and yes, I'm glad you're able to connect and that you know somebody. So definitely tap into their experience and learn from them more about the program. Yeah. Thank you.
Well, we have a scholar graduate here who's now our senator. So do you guys have any questions about what it's like or anything?
Tell you where I work. This is the one I worked in. Right there. This was me for like 4 years. And then I worked for several years at the little ER right there while I was also working. And now I work here in the ER, although sometimes I go to Pahara, but rare. So I still, and we started, I've been meaning to ask, Lisa, we started that community health center in Kona, which I volunteered, the way we did that was I volunteered at the Salvation Army Clinic just to work for free occasionally, a couple of half days a week, until they were able to get, national, what am I trying to say? Startup support, the grant, the HHS.
Community health center grant?
Yeah, community health, sorry. Slipped out my brain. CHC grant, so we got a state grant and the federal grant. I don't know if they have any qualified spots yet. I'm not sure. Kona is not quite as, certainly not as short as Ka'u or where I was, or Hilo is kind of a different thing. But it's not like all rich people in Kona either. I mean, there's a lot of homeless individuals, there's a lot of people that rely on the health center. So I have a feeling that Richard Taft, who's a very good executive director, is probably in the Grand Health Centers in New Mexico, is probably working to get it approved. Do you have any idea?
I don't know at this time, so.
At some point I'll introduce you to him. He's a good guy. We had a great experience over there. But yeah, it was a great 4 years. The real crazy thing was I graduated, graduated, then did residency, family practice, and so I finished June 30th. I got the job in the spring, not having ever been to Hawaii, and then when I got here, it took about 6 weeks to get my license, and after that, I just started. So the first day in practice, Kelly and Dr. Flanders and all the guys will tell you, I mean, it was a shock. First of all, the good news was, since nobody knew me or trusted me as a new doc, I had very few patients at first. So it was like 8 people a day would come in until they started getting to know me, and which was grateful because I had to just look at stuff up. It's how you learn, like you learn a ton in med school, and you learn an incredible amount in internship and residency, but you still don't feel comfortable. You're not just seeing people, no one else around. I woke up that day and I went down to work in Ka'u. Oh my God, here I am. I'm on my computer, I'm calling back to Pennsylvania where my residency was. This is you're fine, remember, you're okay. So for about 3 or 4 months I was like that. And then I realized I just didn't want to wait or hear. Before you know it, you just wake up one day and you're just a doc, and that's all. And by then, they heard there was a nice young doc who had new training and had new experience. So then I was swamped for years, just like maxed out my schedule constantly. I was no genius, I was just new, and they liked me. So it was a great experience. And you go into a community like ours, even when I was an outsider, right, from Pittsburgh, immediate, total acceptance. I mean, by the time they realize you're not going to be some outsider and rude, everybody's inviting you to dinner. And that's not, you hear those stories, it's totally true. Everybody wants you to, come to the first birthday party, and they bring you presents that are, like, I took care of a guy who, I used to do house calls. I was the only guy down there, so if I wanted to, I could do whatever I wanted. So I go to house calls, and this one guy was dying of lung cancer. And it was inoperable, and so I'd go to his house and I'd make sure I deliver his oxygen tank, and I would, sometimes pick up his medicines for him, his palliative care stuff. And one day, right before he died, he said, look, I want to give you some presents. It's like, I feel a little awkward about this, but we become very close. And so he said, so I had my wife load up your truck, your Jeep. Actually, he was living in a Jeep with a dog and stuff. And so they gave me a kayak and a spear gun because they were spearfishing. And I was, pretty wild. Just said, I don't want to accept this. So I took it and I donated it to kids afterwards, but they stayed on our beach house, and you get those experiences. They're absolutely real. You guys might end up, because you're probably all from here, from Hawaii. No? Oh, okay. So none. That's okay. I'm fine. So yeah, you might have that experience I had, or you might end up in Philadelphia. Doing. That's where I thought I was going to go. I thought I was going to go to Philly or New York because I was from Pittsburgh and I just speak Spanish and do my thing. And I couldn't get spots; they were filled. So I just kind of was like, I'll apply to Hawaii, and it happened. So you get those kind of experiences, which are really good. And it was paid well. I mean, it was paid the exact same thing that the other guys were getting paid at first start, except I had, at the time, I think it was actually, this was back about 10 years ago or so, maybe a little more. It was more like, it was 25, 25, 35, 35 at that time.
Right.
But I went to a state school and that paid it all off, so it was cool. It's a big bonus, and going 30 years of loan, or 15 years of loan repayment. So I calculated it one time. I think it was, even though I received $110,000 plus the scholarship, it was worth like $300,000 when I looked at what I would be paying today. So all those kind of experiences are real. They're not, they're definitely not made up. You just have to know that you want to be in one of those disciplines. Don't be like a closet neurologist and you love neurology and then go into National Health Corps because you're going to, oh man, I love neurology and I got to go to my health center. Do neurology, you love neurology, or have that as a special thing that you do, but make sure you're suited for these disciplines. And then you're good. It's a really good experience.
Thank you for sharing.
Yeah, it's great.
Any other questions?
We're lucky to have pizza here sponsored by the Hawaii Medical Association. Dr. Flanders here is the Executive Director of the Hawaii Medical Association. And everybody has to eat a full pizza pie. But come on up and have some before it gets cold.
Thank you.
Thank you.
Thank you.
And they all have green on them. And they're very healthy pizzas.
Dr. Withy, do we want to turn off the video at this time?
Oh yes, we'll turn off the video.